Health challenges today are multifaceted. The approach that recognizes that human, animal, plant, and environmental health are all interconnected is called One Health. 5 EU agencies providing scientific advice on environment, public health, and food safety have published a joint framework for action to support the implementation of the One Health agenda in Europe.
Human pressures on the environment and the changing climate have significant impacts on our health. Despite progress, in some areas, environmental pollution still impacts our ecosystems and is linked to 1 in 10 premature deaths in the EU. Extreme weather events are becoming more frequent in Europe, causing loss of life and posing major challenges for food and water security.
We need to collaborate in a One Health approach across the sectors, at the EU and the global level, to protect human health also against the effects of climate change. Climate change may increase the risks of infections in animals and in return could significantly impact human health. Warmer temperatures could allow mosquitoes to carry infectious diseases like dengue or chikungunya to expand further into Europe. If we tackle this issue from both sides, the animal as well as the human side, we have a much greater chance of minimizing the risks. This is why a One Health approach is of utmost importance to be prepared in the best possible way and to protect people in Europe against new emerging diseases and also future pandemics.
Chemical pollution of air, water and soil arising from human activities can be harmful to our health, the health of our animals and of our environment. An illustrative example is the EU's restriction of microplastics. These tiny particles not only contaminate our waterways and soil, but also enter the food chain, affecting both wildlife and human health.
The health challenges we face today are not isolated. This is something we have learned from the pandemic. Human health, animal health, and the environment are all interconnected. We need to work together to prevent, detect, and respond to environmental and health crises. Tackling challenges such as antimicrobial resistance and disease outbreaks through better prediction and effective mitigation requires a One Health approach.
The human, environmental, and animal sectors cannot effectively combat health challenges like AMR or climate change on their own. That's why it is important to enhance cross-sectoral collaboration. At EFSA, we support the implementation of the One Health approach. This way, we will be providing health assessments going beyond regulatory silos. Because we need to recognize the link between the health of humans, animals, plants, and their shared environment. Ultimately, we will be better at preventing, detecting, and responding to health threats in Europe.
The joint framework for action by these 5 agencies will focus on 5 strategic objectives: strategic coordination, research coordination, capacity building, stakeholder engagement, and joint interagency activities. This will ensure that the scientific advice provided by these agencies is increasingly integrated, that the evidence base for One Health is strengthened, and that the agencies are able to contribute with a united voice to the One Health agenda in the EU.